something. So I want to ask you your thoughts and for you to vote on your thoughts on what was the percent change in child sexual abuse rates between 1992 and 2017. Do you think there was no change at all? It remains the same. You think that there was some decline in child sexual abuse rates? You believe there was a steep decline with 64%, or you believe there was a 5% increase in child sexual abuse rates within this time period? So I will give you some time to answer the poll. Okay, so I think most people, this is still some people answering. I don't know if those who are on their cell phones, if they can vote, if they're just listening. But I'm gonna end the poll and show you the results. So interestingly, 79% of the group present here thought that there was a 5% increase in child sexual abuse rates between 1992 and 2017. And only 3%, only one person believed that there was a 65% decline. And 14%, 14% decline, and only one person, no change at all. So let's see what data shows us. So in your screen, you can see data from NCAN. So these are all childhood maltreatment reported to Child Protective Services between 1990 to 2017. And here are depicted only substantiated cases. And as you can see, we had a 64% decline in child sexual abuse rates between early 90s and 2017. We also had a steep decline in physical abuse rates reported to CPS and substantiated, and less decline in neglect. Neglect was the childhood maltreatment time that remained more or less stable. So one of the potential explanations for the lack of steep decline in neglect is that as more serious forms of abuse, as child sexual abuse and physical abuse declined, professionals or individuals started to report other forms of childhood maltreatment, such as neglect. And the second explanation for these disparities is that there was an increased education about child neglect, including the identification of new forms of neglect, such as newborns exposed to drugs in utero. And this type of increased awareness and also other forms of neglect kind of masked decline in other more, let's say, conventional forms of neglect. So in conclusion, and we can also see for child sexual abuse, we can see that this steep decline being confirmed in other sources of data. So if we take here victim surveys, we can also see a decline from 90s to 2017. If we take, for example, crime data, we can also see a decline. And it's important to see these comparisons between other types of data, just for us to see if this is not a fluke of the data of the cases that get reported to Child Protective Services. So I'm gonna now, this was like a broader picture of child sexual abuse rates. So I'm gonna now zoom in into the child sexual abuse prevalence in youth serving organizations. So compared to the overall rates of child sexual abuse, there are few studies that have examined prevalence rates of child sexual abuse, specifically in youth serving organizations. And to my knowledge, no studies have examined the trends over time of child sexual abuse rates in organizational settings. Now, I would imagine that these trends probably share a similar shape in terms of decline. So we have here this first study. It's a seminal literature review of educator sexual misconduct of studies published in the early 90s to the early 2000s. So it's a study by Cheryl Shakeshaft. Probably some of you or most of you are familiar with this literature review. And I will include here the definition that they used of educator sexual misconduct, just because the definition will impact the rate identified of child sexual abuse. So here, the definition included the behaviors included in the review are physical, verbal, or visual. Examples include touching breasts or genitals of students, oral, anal, and vaginal penetration, showing students pictures of a sexual nature, and sexual-related conversations, jokes, or questions directed at students. So with that definition, in this review of the literature, they estimated up to 10% of children are victimized in educational settings by an adult educator. And you will see that this rate is a little bit higher than the other two studies that I'm going to show. And most likely, this is because this broader definition of sexual misconduct, including sexual-related conversations, jokes, or questions directed at students. And also, it might be this higher rate observed because the studies were conducted with data from the early 90s. And as we could see in the graph that I showed previously, it was a much higher rate as compared to more recent years. So the second study here was also conducted in the US with a sample of over 13,000 children under the age of 18. The source of data is from the National Survey of Children Exposure to Violence. So they compile a sample from 2008, 2011, and 2014. So the definition here of child sexual abuse as, the question asks, did a grown-up you know touch your private parts when they shouldn't have, or make you touch their private parts, or force you to have sex? And by grown-up or youth serving organization worker was defined as a grown-up your child knows from some organization, such as a teacher, coach, or youth group leader. And they identified that 1% of that 13,000 people reported experienced child sexual abuse. While this 1% does not seem a large number, this reflects a population estimate of 36,000 children being victimized. And finally, the third study that I'm going to show the prevalence, just for comparison, it was a study recently published with data collected in 2015 in Germany. So the definition they used in this study of child sexual abuse was sexual harassment or forced to perform sexual acts while in any type of institutional settings. And this included school, group home, foster family, hospital, sports club, choir, Catholic organizations, Protestant organizations, Scouts, or others. So it was very inclusive here. And they identified an estimated of 3% of adults reported experienced child sexual abuse in an organizational setting. So this was a little bit higher than the Fink and Hoare study, the Distracto study that identified 1%, but included, I think, a much comprehensive setting that this child sexual abuse might might have happened. At the end, I'm going to show another study that we are conducting now that is also going to estimate prevalence of child sexual abuse in organizational settings. So any questions so far?
None so far.
Okay.
Somebody asked about resources being available after the presentation, and Becca says yes. And I think that everyone should go back to the OAESV website for those resources after the conference is over.
Sure, I can share these references and also the slides. So, given data from prevalence studies and also accounts shared in the media and also other reports, we know that historically, all types of youth-serving organizations, or YSOs, have experienced child sexual abuse of the children and adolescents they serve. As you know, research also suggests that most child sexual abuse survivors can experience short and or long-term negative effects of their abuse. Also, the impact on the organization in which the child was abused can be devastating as well, with some consequences including lack of trust from the community, bankruptcy, and complete shutdown of the program. How child sexual abuse is perpetrated in youth-serving organizations can vary. However, we know that there are a number of prominent underlying factors that can increase the probability of child sexual abuse happening in organizational contexts. And these factors include staff may drift from organizational policies and practices. Often this drift comes in the form of exceptions that staff makes for individuals working with children. Exceptions typically start out small and they may grow over time. Grooming, or the process of manipulating parents, youth, or staff to set up the opportunity to abuse, can be also common precursors of child sexual abuse in organizational settings. Less common, but often resulting in many more victims, is child sexual abuse perpetrated by powerful youth-serving organization staff, including leadership, board members, or donors. These individuals are often considered above the law, which allows them to commit and perpetuate abuse. And fourth, complacency on the part of the youth-serving organizations affiliates that have not experienced abuse, which can lead to missed opportunities for prevention and may create vulnerabilities over time. So some youth-serving organizations have addressed the issue of child sexual abuse for decades. For example, in the 1970s, the Big Brothers Big Sisters of America have formally started to address this issue. Along the way, other organizations recognize the need to prevent and address child sexual abuse in their organizational settings and started doing so. Today, many youth-serving organizations implement measures to protect the children they serve. But these efforts have been largely ignored in science. The full array of prevention measures employed by organizations and their effectiveness in preventing child sexual abuse in organizational settings remain largely unknown. So to begin to address this gap, the Moore Center obtained funding from the Bloomberg American Health Initiative to bring some light to current prevention efforts. This project included a unique collaboration between researchers and youth-serving organizations. The researchers included myself, Dr. Elizabeth Luterno, Dr. Keith Kaufman, Drs. Ben Matthews from Australia, and also Dr. Donald Palmer. Our safety experts from youth serving organizations included Britt Darling-Luney, Anne Calvo, Juris Colon, Julie Novak, and Drs. Catherine Soul and Bonita Williams. So we worked with our safety expert partners to gain their perspective on common prevention and safety practices and how this practice can be further leveraged to support child well-being. So I will begin now with an overview of our study. So our study had three main goals. First was to index existing measures to prevent and respond to child sexual abuse. Second was to compare these existing measures that organizations have and compare them with existing best practices guidelines. And third was to improve these existing best practice guidelines. The organizations we partner with are among the largest and longest operating youth serving organizations in the US, having approximately 2 million staff and volunteers and serving 20 million children per year. Our partner organizations provided us relevant documents such as policies, training manuals, codes of conduct, checklists, and etc. So we received 161 of such documents, and we screened in 78 of them. So after analyzing 78 of these documents, we identified over 1,400 distinctive elements of child sexual abuse prevention strategies. For example, one such element could be something very broad, such as protecting youth from child sexual abuse is responsibility of everyone here. Or a prevention element could be something very specific, such as staff and volunteers are not to transport children in their own vehicles. These findings have been already published in a peer-reviewed journal, and I can share a reference at the end of this presentation. So in our second step, we then compared these existing youth serving organizations prevention measures with best practice guidelines. We identified what we believe to be the most comprehensive recommendations pertaining to child sexual abuse prevention in organizational settings. On your screen are the sources we used, including the 2007 guidelines from the CDC that is currently being updated, and the 2017 report from the Australian Royal Commission. Our work was also informed by manuscripts based on two models, the situational prevention model and the ecological perspective, when applied specifically to child sexual abuse prevention in organizational settings. This review of guidelines and indexing of measures resulted in the identification of 200 specific best practice recommendations, such as, quote, the organization schedules reviews to update the code of conduct, or, quote, the organization prohibits staff from asking children to keep secrets. We then conduct a crosswalk where we compared the existing youth serving organizations measures to the best practice recommendations from the guidelines. We identify that there is an extensive overlap between organizations' current practices and best practice guidelines. Two areas with less overlap were the inclusion of children and families in policy development and the design of physical environment. So we found we found that the organization's documents had fewer instances where they cited the inclusion of children and families in policy development and design of physical environment. And our team is now currently working on a manuscript to report these findings. So based on our findings, we made a few observations. First, we identified that there are just too many recommendations. It's difficult for organizations across all its units to implement consistently so many rules and regulations. Second, an overemphasis on rules may overshadow other important organizational factors, such as peer behaviors, leadership behaviors, and social norms that govern human behaviors. Third, in the absence of an overarching framework supported by organizations' leadership and team members, rules may get routinely violated. And finally, policy and practice need to be tailored to each organization's mission, risks, and constraints. So with all that in mind, we developed the Leadership Desk Guide. In this desk guide, we present a core set of rational principles that flow from an unified framework and that can help guide the development of individualized protocols to best meet local needs by addressing local risks with tailored strategies. So in the desk guide, we focus on only 8 practice areas. And these are: first, focus on child well-being, build on training, increase monitoring of adult-child interactions, collaborate with children and parents, identify and address safety concerns, increase accountability, address youth sexual behavior, and finally, strengthen human resources. So I'm going to go a little bit more in depth within these 8 practice areas. And I want to ask if you have, before I continue, if you have any questions about our research findings and methodology.
So far, I see no questions. I dropped the link for the desk guide into the chat for you, for all those in attendance. I am wowed so far. I'm sure everybody else is too, so.
Okay, so I will continue. Okay, so the first practice area refers to focus on child well-being. The core of this practice area is to instill throughout the organization a dedication to child well-being and safety as a prevailing culture above all other organizational goals. So child well-being and safety can be made a priority in a couple ways. Well, first, by maintaining professional behavior within the context of caring relationships. So caring and professional relationships can deteriorate into inappropriate and harmful relationships through boundary violations that increase gradually the intimacy of the relationship. Boundary violations are not necessarily intentional and thought out behaviors and may result from a lack of knowledge, momentary lapses in memory or judgment. Second is leadership by example. The manner in which leaders interact with children or how they discuss children during formal or informal meetings will influence how staff and volunteers perceive and treat the children they care. Likewise, the manner in which leaders interact with staff and volunteers will have a strong impact on organizational culture. Leadership behavior is then a critical source of information to staff and volunteers, perhaps even more than formal trainings. So our second practice area refers to build on training. So training can reinforce an organizational culture of child safety. And training, as you know, can be directed at staff and volunteers, children, parents, youth. Training components include the development of knowledge about child sexual abuse, attitudes about child protection, and awareness of key policies and procedures about child sexual abuse prevention and response. So to reinforce, training comes hand in hand with leadership behavior that will continue to model a commitment to child safety. The third practice area addresses the need for increased monitoring of adult-child interactions as an important strategy to enhance the safety of children participating in youth serving organizations programming. So this approach here requires, however, tailoring to meet the differential needs of both place-based organizations such as a dance studio or a youth sports program, and also one-to-one mentoring programs. It's interesting that most of the guidelines that we examine does not do this distinction between mentoring-based programs and bricks and mortar programs. And in mentoring-based, increase the visibility or increase the line of sight in traditional ways might be harder. So the most direct way to ensure that adults maintain a caring and professional relationship with children that we just spoke about is to make certain that adult-child interactions are observable and interruptible. Typically, we behave towards others or in the presence of children with greater care and professionalism when we are in the presence of our peers or supervisors. This is just social control. So a few principles guide this practice area. So one is to design the organization's physical space to maximize the visibility of child-adult interactions that we just spoke about. So ideally, an organization's buildings are designed or redesigned to enhance visibility. And this can be done, let's say, through the use of half walls versus floor to ceiling walls to divide spaces, or the use of glass panels in offices. Not always this is possible to do. And when this is not possible, we can create rules to enhance the visibility of adult-child interactions. And these rules can be things such as having 2 adults in a room whenever a child is present. However, this may also not work in cases such as mentoring programs who are based on one-to-one interactions. When that is the case, there are some strategies that were developed and well applied by, for example, Big Brothers Big Sisters of America, that is a triangulation where you have staff have conversations with parents, youth, and mentors to collect feedback on the relationship between mentors and children, and also to collect descriptions on recent interactions between mentors and children. If discrepancies arises between these three sources of information, parent, children, and mentors, the staff will then follow up to check safety concerns and rule violations. So we were really careful here in this practice area number 3 to be very inclusive of all different types of programming in youth serving organizations. I want to say that the prohibition of one-to-one interaction does not work for all types of programs. So practice area number 4, to collaborate with children and parents. Organizational policies and practice are often developed and revised without substantial input from parents and especially children. So a few ways to address this principle are to provide parents and children with clear information on how to prevent, recognize, and respond to child sexual abuse. So in this way, not only are organizational members trained to prevent and address child sexual abuse, but so are the child participant and their parents. Another key component is to encourage parents to participate and even to do unannounced visits to the youth serving organizations. And third, we recommend that organizations with sufficient resources to survey children and parents to obtain data on staff's fidelity to organizational principles, policies, and rules, and to start to identify whether these are being violated or are being followed through. So our fifth practice area that is really connected with stakeholders' participation is to identify and address safety concerns. So the general goal here of this practice area is to identify and resolve safety concerns that are specific to a setting. So for example, if a child care center has several locations, the goal here is to identify and address safety concerns that are specific to a single location. And this is done by first identifying risks that can belong to several categories. And these risks are identified with input from key stakeholders that include youth and parents and also staff from that specific locations. So the risks can be classified overall in 4 ways. First, we have environmental risks, and those are risks related to the youth serving organization settings. So for example, it can be poor lit grounds, there's no light around the facility, for example. We also have risky situations that may include an organizational programming that includes outings and overnight trips that always increase risks. We also have risks that are related to routine activities. And these are behaviors and activities that happen on a regular basis and have the potential to increase the risk for child sexual abuse. So these include example as staff routinely driving a youth to their home because they don't have a ride home, for example. And also policies. So this category reflects missing policies or policies that are in need of updating. For example, policies regarding social media use. We also have here, within in the other steps, we have stakeholder input. So with input from, again, staff from that specific location, parents and youth, will then prioritize and generate solutions for all of these risks identified. So this is very well described in Keith Kaufman's work. I can also, in the situational prevention model, he has done this work beautifully applied to sexual assault, to the prevention of sexual assault on campus, and also now to use safety in sports. And I can leave a reference for you as resources through the conference. So the sixth practice area addresses organizations' accountability. So accountability requires youth-serving organizations to have systems to document consistent implementation of policies and practices and evaluate their impact. To evaluate child safety practices, organizations can survey or interview their participants or youth and parents, for example. They can also interview staff and conduct an external independent oversight. These evaluations mechanisms can provide an opportunity to identify underlying causes of broader problems or systematic problems. So policies, rules, or norms that are found to be often or routinely violated should be targeted for review and to be addressed. So the second practice area is to address youth sexual behavior. So guiding this practice area are a few principles, and included here are three of them. First, many youth-serving organizations train youth to recognize, resist, and report to sexual abuse. And when properly conducted, these trainings can increase knowledge about sexual abuse and may help youth to disclose ongoing sexual abuse and may reduce self-blame, which are extremely important outcomes to have. However, victimization-only focus may fail to provide youth with guidance about developmentally appropriate behaviors and may overlook the fact that more than half of sexual abuse against children and youth is perpetrated by another youth. So in this context, we believe that it's also important to guide youth, including teen leaders, to guide them with information about appropriate or inappropriate physical and verbal interactions, the nature of consent and coercion, and the importance of maintaining behavioral boundaries, particularly with younger children. So second is to move beyond a zero tolerance approach. So a zero tolerance approach also fails to recognize the reality of youth as sexual beings. Responses to youth interactions should include a range of options, including ignoring certain behaviors such as holding hands. It can also include redirection of behaviors that are consensual, and also immediately intervene and end coercive sexual interactions between youth. And third is to be alert for bias. So research demonstrates that mutual sexual exploration or behavior between youth of the same sex, between LGBTQ youth, and between Black youth is more likely to be reported and acted on than behavior between white youth of different sexes. Research also demonstrates that youth with cognitive and physical disabilities are often incorrectly assumed to be not interested in sex, and less likely to be educated about appropriate sexual behavior and concepts. So we believe that organizations should strive to ensure that all youth in their care are provided with developmental appropriate guidance and have appropriate responses. And finally, our eighth practice area addresses to strengthen human resources and management. So some of these principles that guide this practice area includes a strong focus on recruitment and selection that beyond identifying risks for perpetration of child sexual abuse, such as background checks and all of that are very important components, to also include communication to potential applicants of the organization's strong commitment to a culture of child safety, its policies and practices that are designed to identify and prevent child sexual abuse. We believe that this communication to the organization's commitment to the prevention of child sexual abuse is already an important deterrence step. Second is to understand the importance of training, the difference between training and socialization that I alluded to in the beginning, in the middle of this talk. So while our second practice area addresses the need for training, we also understand that training alone is not enough. The way that staff and volunteers is socialized into the organizational rules and practices on a daily basis may have an even stronger influences on their attitudes and behaviors towards a child. And third is adequate supervision. So this concludes the presentation of our practice areas. And I'm gonna now show you, are there any questions?
Hang on here. Yes, there is a question. Do these practice areas look different in person versus virtually? You know, with the pandemic, we've all been forced into this virtual environment. Different activities, recommendations, child response, etc.
Mm-hmm. Yeah, it's interesting because this was developed before the pandemic hit. So we didn't have a chance to include in here a more, let's say, tailored of these practice areas to what's happening now with the online setting. But I believe that the practice area that addresses monitoring of interactions would need to be adapted to the settings of an online environment that we are having now.
As you were presenting the 8 areas, things that were coming into my mind were various programs like Darkness to Light, for preventing child sexual abuse at the organizational level, and Shifting Boundaries. And I was curious if any of those programs were included in your review.
No, those programs were not included in our review. My understanding of programs like Shifting Boundaries, for example, is a program very directed to youth or to adolescents, and I think they also have an environmental component of changing of the environment of the building of schools, but we didn't include those specifically. We are really looking at more of these broad guidelines, specifically to youth serving organizations, for example, as the CDC guideline, that is very, very broad, that looks at also staff and volunteers and all the other aspects of the organization. So these are the type of guidelines that we included.
Thank you. And again, folks, please, if you have any questions, drop them in the chat, and I'll continue to monitor the chat and bring questions forward.
Thank you so much. So I'm going to show you our website just to give you a brief peek of the website and where you can find the desk guide. So I believe I will have to reshare my screen, so just bear with me for a little bit here. So can you see my screen again? Yeah, I would think so. Yes, thank you, Rebecca. So here's where you can find our desk guide. So in this website, you can have a video, you can watch a video, a brief video about an overview about our study and also about the desk guide. You can also learn a little bit more of all of those partners involved. Here you have the 8 steps that I just presented to prevent child sexual abuse in organizational settings. If you click in each one of them, you have critical questions to ask. So the way we develop the desk guide, you have like all these intense text about each one of the practice elements. And then we have some questions that you can ask yourself to check if your organization is doing each one of those elements or subcomponents. This is our research team. You can here listen to a podcast by Elizabeth Luterno and about our work. You can download the desk guide, and we are hoping that people also leave us feedback on how they are using the desk guide. So let me now go back to my other screen. Give me just a minute. Okay, so I'm assuming you are seeing again my screen. Yes, thanks again, Rebecca. So here I just included a sample of these desk guide tables that you have at the end of each practice area with critical questions to ask, the goal, and also some examples of actions to achieve those goals. So the desk guide, just a moment here. Sorry. So the desk guide offers, we believe, a potential path to better prevention as it reflects on a solid evidence-informed foundation. Again, we reviewed organizations' documents of what they are doing and also prevention guidelines by main organizations such as the CDC. We also aim to have a shift towards efforts to achieve overarching prevention goals. We believe that instead of adding one rule on top of the other, we believe that having overarching goals might be a more useful approach. And also another strength we believe is this commitment to the development of caring and professional relationships between staff and volunteers and the children they serve. We also, another key feature of the desk guide is the emphasis and importance of tailoring strategies and approaches to specific needs of EU-serving organizations. So safety measures can be tailored to match the type of program, the organizational setting, and also specific safety concerns. For example, as I mentioned before, several of the best practice guidelines are designed to place-based youth-serving organizations and prohibits one-to-one child-adult staff interactions. And this language is contrary to mentoring programs that are actually designed to establish a one-to-one relationship between a mentor and a youth. The desk guide acknowledges mentoring programs, structures, and recognizes the different ways you can monitor adult-child interactions beyond only the concept of increasing visibility and maximizes other monitoring strategies that are also feasible in mentoring programs.
There's another question, and this is
Sure.
a really interesting question. Can you talk a little more about the disparate responses of youth who are Black, Indigenous, people of color, white, and/or LGBTQ+? Are there specific recommendations or considerations given intersectionality of child sexual abuse?
Yeah, so the responses that I mentioned in there to youth sexual behavior is to really address biases in the adult responding to the sexual behavior that tend to be much more punitive when it's a sexual interaction that involves a Black youth or LGBTQ youth. And this is something that we called attention in our guidelines from people involved in youth service organizations to have a less biased, if that's the case in their organization, to have a less bias or more attention to biases in response to don't be as coercive. And we know that this is true for not only sexual behaviors, for any type of, let's say, acting out in schools. We know that Black youth are more likely to have suspensions and punitive responses as compared to white youth. So have something that is more across the board fair to youth.
Thank you.
So in conclusion, so while this desk guide was articulated and written by a group of researchers, our youth service organizations board members that I mentioned in the beginning were involved throughout the whole process. So they checked our work to ensure that what we were proposing resonated with their on-the-ground experiences in promoting environment while keep children safe. We recognize that much of what we propose is already reflected in many organizations' policies and practices, and indeed this work was informed by best practices, guidelines, and current organizations' child sexual abuse prevention efforts. Our hope is that this desk guide protects children from abuse by promoting a coherent, unified, and less complex abuse prevention efforts across youth serving organizations. So I'm just gonna tell a little bit more about our program of research. So for the next steps, we have obtained funding from the CDC to evaluate whether there was a decline in child sexual abuse victimization and boundary violating behavior over time as a result of youth serving organizations' prevention measures. So to answer this question, we developed a comprehensive survey instrument to be answered by a nationally representative sample of adults, of about 6,000 adults, ages 18 to 28. And our survey items capture both victimization by adult members of the organizations and also by peers. We also capture a variety of youth serving organization settings, such as organizations for recreation and culture, religious organizations, music and arts programs, and K-12 schools. So this is an ongoing survey project. We plan to launch our national survey at the end of this summer, and we are hoping to have preliminary findings by the end of this year or by early 2022. So here are some of our resources. We have here the paper with, we have here the sites for the desk guide, the websites, the podcast, this podcast is with Elizabeth and Dr. and Keith Kaufman, and also the findings from our AIM-1. And I can also add the references that I cite in the beginning and send to Rebecca for her to add as resources in your conference websites. So here's my email if you have any other questions, and I am here now to answer any questions you may have.
I asked the participants a question about how they might use the desk guide in their practice or in their organizations. I think it's brilliant, by the way.
Thank you. Yeah, it was an effort, as I said, of many people. And one thing that was interesting that we had as part of our research team, Donald Palmer from UC Davis, and he is an organizational psychologist. So this was something that we really wanted to include a little bit more of organizational theory in our desk guide.
I know a lot of the folks that are participating are working in prevention, not necessarily specifically in youth serving organizations, but they serve youth. And there's a question or a comment here. I would love to use this information to create one-pagers of information for teachers, administrators, and community service providers that I work with. Like to pull out.
I think this would be great. And if you want, I can offer you, if you want to create a one-pager and send it to me, I can take a look, to see if it's consistent with what we're trying to say. I would be happy to do that.
That's fabulous. Other ideas about how this could be used in your practice? And Becca's saying conference materials will be available on the conference webpage after the conference. So this has been recorded and it will show up there, including the PowerPoints.
Yes, and we also want to hear if you ever use in your organization this desk guide, if you can then reach out either to me individually or provide a feedback in our website, because it's important to know the impact of your work or how people are really using or how it's being useful or even not how it's not being useful for people in their daily practice.
Yeah, and this is great because clearly it is based in evidence. You've done the research, you've come up with the practice guidelines, and Jessica says we have been trying to get into some policy work for schools that we teach in. And I think this would be so helpful in shaping our approach.
That's great.
Absolutely. Other ideas? What age groups did this look?
So we didn't have a specific age group, but most of our organizations, while I cannot cite their names, they were organizations for recreation and culture that serve millions of children. So I think their organization serves, I wouldn't say babies or toddlers, but I would say maybe children ages 5 or 6 and up.
Any other questions for Dr. Assini-Meytin? This presentation was great. And I really thank you for doing the years of work it must have taken to get you to the point of issuing the guidance for practice. Ashley asked, do you have any tips or insight on how to talk with teachers about interactions with students? I find that many take offense, feeling like we think they would harm a child.
Yeah, that's a interesting question. I think I would frame this as something that is just an organizational policy, and it can happen in any organization, and not by someone that we are not targeting someone specific, but really the culture of the organization. This is not how can I say, something that is a policy targeted a individual. And I think that the stigma around child sexual abuse is one of the things that makes it so hard to prevent it, because it's so hard to intervene on early signs, particularly in an organizational setting. Because if you have anything that can be an early indicator, you might harm the career, you might harm the person's life forever, really. So then you need to wait until you have 100% sure, which means that the child is already harmed or several children are harmed. So really, I wish we could live in a society where we could talk about behaviors, we could talk about early signs without having anything too heavily attached, so we could really intervene early.
You're really speaking about that shift of culture and the norms change that needs to take place in organizations, top down or bottom up.
Yeah.
Other questions? Let's see. That's why we need social workers and psychologists at schools that are the go-getters and will advocate towards this. Agreed.
Yeah.
Yeah. There's a big push to have school resource officers or police in schools. It would be great to also have social workers and counselors in those schools as well.
That's right. In some larger organizations, they have positions that are only designed for to oversee child safety and protection. It would be great if schools could have something like that too.
For sure. I am not receiving any more questions here. And is there any final thoughts that you would like to leave with us, Dr. Assini-Meytin?
Sure. So again, if you use any of these resources, we are happy to hear from you, to hear your feedback. It's always good for us to know. We have all this work of researching, writing, and then putting a product out there. And it's always great to hear how people are using, how it's been helpful for them in their daily lives, in their practices.
There are lots of thanks coming into the chat box now. And we're going to go ahead and wrap this up and give the participants back 15 minutes of their time today. The next thing on your agenda is a break until 1 o'clock. Your workshops will convene at 1 p.m. and make sure you refer to the conference site, oaesv.org/2021 conference program for your next workshop opportunity. And I want to let you know that the CEU code word for this presentation is CARE, C-A-R-E, and I'm going to drop that into the chat right now. So CARE is the code for this workshop, and we want to thank you very much for your participation and your great questions, and enjoy the rest of the conference. And thank you very much, Dr. Assini-Meytin, for sharing with us the resources and your great work.
Thank you all. I appreciate your time today.
Thank you.
Bye.